I'm Kayla,
And I'm Baobai.
and we are here to talk to you about the role nutrition plays on oral health and overall health. There are 5 stages of a human's life: infancy, childhood, adolescence, adulthood, and geriatric. Throughout these life stages, many factors can cause destruction to the human dentition. We are here to discuss just a few nutritional factors and explain how just having one moment of nutritional deficit during a life stage can affect a person's overall quality of life, expected life expectancy, and risk of serious health conditions during the geriatric stage of life.
Okay, so we're going to start with pregnancy. First off, a baby's health starts with the health of a mother. Therefore, it is very important that a pregnant woman receives an adequate amount of healthy nutrition. For example, pregnant women who don't eat a nutritional diet are putting their unborn child at risk for birth defects, but more specifically, a lack of folic acid, which can lead to a cleft lip or palate, as shown on these pictures here. This is the cleft palate and the cleft lip on this picture here. If the pregnant woman has a preference for sweets, the child will also develop a preference for sweets. This is why it is important to educate pregnant women on a well-balanced diet so they can get used to a healthier pattern of making better food choices. One important factor that not a lot of women understand when they are trying to conceive is that they have to have appropriate weight gain, adequate intake of essential nutrients, and maintain nutritional status for a successful pregnancy. If the nutritional status is poor, the placenta is unable to perform its function. Good food choices for adequate nutrition is the most important and most ignored when it comes to determining pregnancy outcomes. Unusual dietary patterns can occur in pregnant women. This condition is called pica. And pica is an abnormal consumption of specific foods and non-nutritional foods such as dirt, clay, baking soda, paint chips, stones, cloth, baby powder, starch, large quantities of ice is also an example. Personal beliefs about cravings influence diet selections in some cultures and regions. Pica is usually practiced by women from lower socioeconomic status or have less than a high school education, are in poor nutritional health, are affected by behavioral and environmental health factors such as drug and alcohol abuse. The result of pica can lead to teeth wearing down quickly because of the roughness of the non-food item being consumed. This is what you will normally see in a patient with pica, which is the wearing of the teeth on the chewing surfaces here.
Okay, next we're going to talk about children. It's a common misconception that childhood caries and childhood tooth loss will not impact the permanent dentition. It's important to understand the role that nutrition plays toward keeping children's teeth healthy. Drinking beverages full of sugar, eating processed prepackaged snacks, not eating raw fruits, veggies, or proteins, in combination with poor oral hygiene habits, can be a terribly destructive combination. If people develop unhealthy food patterns as children, it's very likely to follow them into adulthood. A diet full of carbs in combination with inadequate plaque removal puts a person at risk for caries, gingivitis, and periodontitis and tooth loss. Another factor that negatively impacts dentition is eating disorders. An eating disorder typically is classified as anorexia or bulimia. They are commonly associated with young women who have an exaggerated, intense fear of becoming fat. This leads to controlling body weight by seriously restricting food or binge eating and purging. Anorexia can cause nutritional deficiency that can impact oral health. Some oral manifestations include severe dry mouth, red edematous gingiva, red, painful, dry, cracked lips, canker sores, and halitosis. A frequent binge and purge cycle is very destructive to the dentition. Enamel erosion, deformation of tooth structures, Weak, brittle, sensitive teeth, tooth loss, erosive lesions, and arthritis of the temporomandibular joint the impact eating disorders have on oral health. These impacts on oral health will follow these patients through the rest of their lives. There are also a number of systemic health conditions that can have a negative impact on a person's oral health, but I'm going to touch on uncontrolled type 2 diabetes because that is a condition that's typically impacted by nutrition. A person with uncontrolled type 2 diabetes is at risk for severe periodontal disease, alveolar bone loss, and tooth loss. It also leaves patients with a lower resistance to infections, slower healing processes, xerostomia, altered taste, burning sensation of the mucosa, high risk of caries, and oral candidiasis. It is so important to counsel diabetes patients about proper nutrition and ways to lower their carb intake so that they can get their diabetes under control. This condition can really take a toll on the dentition, and that can have a major impact on the overall quality of life.
So, as Kayla has mentioned, that there are 5 stages of life. The last stage of life is the geriatric stage. This is where we can discuss a few things about how nutrition can affect the oral health. Today, most older adults, 65 and older, are becoming more edentulous. Therefore, the function of mastication is decreased, which influences their decision in certain foods. There is also a significant change when an elderly patient has to transition to wear dentures. For example, when they start wearing dentures, they prefer consuming foods that are softer and avoid fiber-rich foods such as vegetables, which hold nutritional value to their diet. Several implications of wearing dentures include an ill-fitting denture, soreness due to ill-fitting dentures, which then lead to sore spots, extremely resorbed mandible, difficulty chewing, sudden putting on weight or weight loss. The most concerning factor is painful sores, which lead to a loss in nutrition, which leads to the patient being unable to adapt to using the denture. In most cases, partial denture wearers are less likely to have problems with nutritional intake compared to full denture patients. For instance, an elderly with a complete upper denture has reduced sensitivity, which decreases the pleasure of eating and reduces nutritional intake. Xerostomia is also a concern with elderly patients. It reduces dentures to adhere to the upper palate, which makes it hard for them to chew and obtain nutritional intake. Some nutritional deficiencies include fiber, potassium, vitamin B6, iron, calcium, and zinc, which causes decreased or modified immune responses. With the lack of consuming fruits, vegetables, and fibrous foods, fat intake is higher, which causes other health concerns like diabetes or obesity.
Okay. So by now you have a good understanding of the impact nutrition plays on oral health and how that can affect the last stage of our lives if we don't keep our teeth healthy. To preserve quality of life and life expectancy for the elderly, I challenge you to counsel your elderly patients not just on what foods are healthy, like these hard, crunchy foods here that are hard to chew, but also on foods that are both healthy and appropriate for their dentition, like soft foods, like boiled eggs, string cheese, oatmeal, foods that are going to be easier for people that don't have teeth to eat. While you're at it, don't forget how important it is to stress proper nutrition to everyone in all life stages. If we can prevent the incidence of nutritional deficiencies that lead to damage of the dentition, perhaps future geriatrics can have a stronger dentition, better quality of life, longer life expectancy, and less chance of diseases.